Hi, good morning. Buenos dias. Welcome. I hope you are hanging in there, staying positive, and focusing on what you can control. Thank you for joining us, and I hope you have your cafecito ready to go. Uh, Thank you for joining us. We have a guest, Dr. Federico Herrera, joining us today. And Federico, I don't see you yet, so just a reminder, there you go. We want to see your
Buenos
face.
días.
Buenos dias. For those of you who haven't had a chance to meet out there, my name is Patricia Mota, currently serving as President and CEO for HACE. Our mission to positively impact the workplace by cultivating the pipeline of Latino talent. We are also currently in our end of year campaign focused on providing grants to students, college students that have been impacted by the pandemic financially. We awarded our first 15 college students thanks to all of our donors out there. We reached nearly 17,000 of our $25,000 goal. And so please, if you haven't done so yet, consider donating. And today is we have our guest to talk about the news that came this week, right, with the new vaccine. So I've introduced all of you to Dr. Federico Herrera, who's currently the Little Village Site Medical Director for Esperanza Health Centers, the lead pediatrician there, but also led a very important role this year as the COVID-19 lead physician for the health center. So first and foremost, Dr. Herrera, thank you for your service and your work, especially during such a fearful time, I would say. And so on behalf of the ASE community, just want to thank you and welcome you.
Thank you so much for this opportunity. It's always a pleasure to try to do my best to spread the word, inform people, which I think misinformation is one of the biggest challenges when trying to provide health. So I think by doing this media, I think that's pretty much my goal, to make sure that people know what are they facing regarding not only COVID, but also the COVID vaccine, which I know is a little of the biggest news right now, right? And COVID is still out there and it's hitting hard again. So definitely we want to make sure people understand where we're facing and what can they do to prevent, and more so not getting sick and prevent. That would be the main goal.
Exactly. No, thank you. And we'll get into that. So first question that I have for you, because this is our Cafecito con ACE, is how do you like your cafecito or coffee prepared?
I'm actually a very old-fashioned kind of guy, just like my coffee black. I don't put anything on it, but every now and then getting a cappuccino is always good as well. But
Nice.
I'm old-fashioned. Black coffee is my way to go. Every morning, at least 1 cup, my fuel.
I agree with you. It's also the healthier option, right?
It's true, absolutely, yeah.
For folks like myself, I love to drink several cups throughout the day. So if I added sugar every time, that wouldn't be a good thing. So I take it straight. And so today's we're talking. Can you tell us, because of the ASE work that we do, we have not only youth and students tuning in, but also professionals. And so we always like to get to learn more about our guests in terms of your cultural and your professional background and how you got to becoming a physician.
Absolutely. So racially, I'm considered white. I'm Latino. I was born and raised in Argentina. I came to the States about 15 years ago. I came to Chicago about 12 years ago. I did my med school back in Argentina from beginning to the end. Not that it's any better or any worse, but it's completely different setting. So my best take from doing my medicine school in Argentina is we have a lot of hands-on experience. When we come in here, it give me a huge advantage. I came to the States to do my residency. I did my residency at Cook County Stroger Hospital from pediatric residency. And while I was actually doing my residency there, I did what is called a continuity clinic here at Esperanza. So I actually been in Esperanza for almost 12 years now. And I've been working directly with the community Latinity from my time with Stroger from here for pretty much since I was, I could say, born and raised and in the community Latino community here. So
yeah, no, and I'm sure you and your cultural background and even being bilingual, right, makes such a huge difference for the community that you serve. So thank you for that. One of the big questions I've been hearing a lot, especially this week, right, there's several interviews and studies that indicate the distrust among the Black and Latino community on taking the vaccine. Even, from, personal friends that I've talked to, I can say, it's a very similar trend. In fact, one study that was released by the COVID Collaborative, where both individuals are surveyed from the NAACP, which serves, the Black community, and Unidos US, who serves the Latino community, found that only 14% Black Americans trust that a vaccine will be safe, and that 34% of Latino Americans trust that it will be safe. And not that much different in terms of those that say that they trust that will be effective. So why shouldn't we be taking, and a lot of it has to do historically, right, with the distrust with the health community, with the Black and Latino community.
Yeah. So first of all, again, it's all about misinformation. And then there's a study also that it uses 3 words that I think kind of describes why this happens. One is intent, the other is uncertainty, and the last one is refusal. Mm-hmm. Intent, some is how much that patient really has an intention to actually even be informed or actually getting the vaccine. It's just about like the drive of that patient to seek, you're not talking about the vaccine, but medical attention overall. And certainly which I think is the biggest one, is a brand new vaccine. And then people don't know what they're facing. And they, given exactly what you mentioned before, this distrust with medicine in the last decade or a little plus minus, especially with the media and all the misinformation created through media, creates that this fear that you're putting something in your body is going to hurt you, when actually, and people understand that the studies and the intense studies and all the robust information and data gathered before something is released is impressive. Even I know it's an incredible amount of short time that this vaccine is released, but if you see the amount of studies that have been sent, papers that are being sent and have to be reviewed. Last time I checked, I think every single day over 2,000 papers are being sent with data wow. being reviewed over and over. So it's not something that is being sent in the blind to see what happened with the population. Although it's a very short amount of time, it's been a lot of information. It's true that one of the biggest things we don't know yet. So when we are facing it, when it's something that is new, it's going to happen in the long run, like in 2-3 years from now. I actually enrolled myself in a study for COVID vaccine that is supposed to be a 2-year study long. So just to get the vaccine, get the booster, and then continue participating in the study to see what is the long-term effect of that vaccine. So that's pretty much the big thing about the community, that the distrust and, again, the misinformation primarily that is generated.
Mm-hmm. So those of you tuning in, please have your questions ready, but I also, put in the comment box any concerns that you have when it comes to taking. And my question back to you, Dr. Herrera, is what action should we take to ensure that we're creating awareness, not only for ourselves, but for the communities that we represent, whether you're influencers or even with our immediate families, right? In terms of encouraging to take action. And my understanding is, first, the primary audience right now is physicians, those in nursing homes that would be getting the first round, and then the general population probably in the next 3-4 months.
Yeah. So the number one thing we can actually deliver is information. Just provide right information, backup information, real data that's gonna prove that what we're saying is right. It's not just somebody saying a single experience. I know one of the first things that came up in the media as soon as the UK started giving the vaccine, for example, there was 2 people getting a severe allergic reaction, and people started getting upset. Oh, it can actually harm you. Anything you put in your body, consider starting from food, for an antibiotic, for anything that you put in your body can actually potentially create you an allergic reaction. So vaccines are known to, many of them can cause some allergic reactions, but not everybody's going to get it. Actually, it's very few. If you consider the thousands of those that have already been applied, only 2 people getting it. And that's why we need to learn. It's like when a brand new phone you buy, it's a brand new brand phone. Everything's working, looks beautiful, but what happens then the next day or 2 days, they send a new firmware to update that phone because they know some things that were not seen when they were study phase, they appear. And as they appear, we can get more data. And so it's extremely important, first of all, to get all the data right. And then as we are getting to release the information into the general public, more data is going to be gathered and more information going to be released. Nothing is being hidden. Actually, the ACIP, the CDC, the CDPH are all very much involved in creating this new system where all the data is supposed to be gathered, and then so we can actually be learning pretty much on the fly. And that's what we're doing with COVID right now. We're learning as we go. So we know, like when we started from now, the amount of information that we receive and the things we know right now for treatment, for prevention, and now even the vaccine, that's a huge game changer. And that's what they need to make sure they understand. Vaccine is a game changer. We are literally talking about perhaps, hopefully, the beginning of the end. That's what Dr. Esike said, and I absolutely agree. I know her personally. That's the beginning of the end.
The beginning of the end, I mean, I just am so impressed by the speed, right? I was reading an article in the Wall Street Journal that talks about like these companies and how the process in terms of coming out, but also all the research that was done behind in such a fast manner. But lives are at stake, right? We're at what, nearly, or I think we've already crossed over 300,000 in terms of deaths in the U.S. And so I think that's why this week was so hopeful, right? That now there's a vaccine. And so I encourage, right, that we have to take it and encourage others to take it. So as a lead, and you can all please, have your questions and your comments ready. Dr. Herrera, as the lead also pediatrician for the health center, how about children? What do you know about children and the possibility of having a vaccine for them, or, in terms of taking precautions in the coming year as well?
So as of now, there's only one approved, FDA approved, emergency approved vaccine, which is the Pfizer one. Not to give brands, but that's the only one approved at this point. Moderna may be approved, maybe also as early as of today. We don't know, maybe in the next 48 hours. The recommendation for Pfizer at this point is 16 years and older. Only at 16 years and older. Anybody 15 and younger are not at this point, as of now, approved to be given. So the most important thing we can do from pediatrics perspective is prevention, and that's difficult to do. So we're talking about, again, pediatric population, where they depend directly on their parents, and parents have to go out and work, and they come back. They do their very best they like to change, to shower. I know, like many of my patients, actually they do that, my parents. But what happened with the community, Latino community, that's what happened with me. I'm Latino, I'm from Argentina, I drink mate. I had COVID, and then I know exactly how I actually passed along the COVID to my youngest one, and I was sharing mate. So, and that's what Latino do. We share, we hug, we kiss. And by doing those things that are defined as our community we are, sadly, that's how COVID fits, how COVID actually spreads. And that's why we've seen so many times of the spread within the household is by, again, those contact with the same, like the parents or grandparents or anybody directly involved with the care of the kids. Thankfully, thank God, COVID is not aggressive on kids. There are being reports of kids getting sick, but it's not as serious as in older patients.
Well, thank you for sharing all of that insight. I think we'll take a question or two now from our audience, and we'll see it. We should be able to see it on the screen here shortly, and that's from Julie Villegas. How safe is the vaccine for children? I know the vaccine makers didn't include children in their studies. How long before there is a new study for children? So I think that's just some kind of what you just mentioned. You want to elaborate on that?
Yes, 16 and over, what I was experiencing is like safe as in adults. How long is the study? So children are defined as a risk population, say with the pregnant ladies. So usually it's not something that you for the most part you don't do a direct study on children. You should do like try to like move the information from adults and then try to like move into children. So right now they're not going to be conducting any particular studies, as per my knowledge. And as we continue to report the safety on vaccines on kids at 16 and over, likely they're going to start lowering it down. But as of this point, as per my knowledge, there's no studies, unless there are massive studies being involved, like the younger children.
Thank you for that. And then we'll have time for one more question, and that's from Nira Kataria on the ASSA team. How do we go about after the vaccination? Do we still social distance and wear masks? How long? That's a great question.
That's a great question. Absolutely agree. So vaccination. So a few things about vaccination. Three things about vaccination, as always, not just about COVID vaccine, but any vaccine, including flu vaccine. Please get your flu vaccine. Number one, vaccines are developed to not get sick. Absolutely true. And that would be the ultimate success of a vaccine. Like the polio, to give vaccines to eradicate a disease. That would be the ultimate goal. Second goal, if you still get it, to mitigate the symptoms, to make sure that your symptoms are not going to be as bad as if you were not getting the vaccine, and they'll tailor it right with that to try to minimize the complications as well. And ultimately, and that's where I try to explain this to all my patients, is about decreasing the mortality of a disease caused by a virus or a bacteria. And that's what people don't see. Just a quick thing, for example, consistently throughout the years for flu vaccine, people hear the effectivity in the media, like 20%, 30%, 40, 50%. But at the end of the day, if you see the mortality rate, out of four patients that die, 3 usually don't get the vaccine. So although vaccine is not perfect, it will like 1 every 3, I think is still a success in the vaccine without being perfect. So vaccines may not ultimately avoid getting sick or even complications, but it can avoid you from dying. In this case, we know that our population is getting hit very hard, and sadly, we've seen a lot of mortality rate.
Yeah. So I think we have one more good question that's coming up. So thank you for that, from Miguel Morales-Corujo. And what is the difference between the Pfizer and the Moderna vaccine?
So the thing about especially about the Pfizer one that's been released right now, we know more about it. It's a brand new kind of vaccine, which is what's called mRNA, messenger RNA, which is they've been studying for years now, and it's not a new vaccine, but it's the first time it is approved in the United States. And the difference is that instead of actually directly inoculating a viral particle in your body, they do this little information to your own body to produce that particle, and then your body will recognize that little protein in your cells and create that natural response. I know Moderna is also working this in a very similar way, but the difference between the different brands is not so much the way it acts, but also what particular kind of, it's called an antigen, what kind of protein they use to try to create the most amount of immunogenicity and the most amount of antibodies. Sometimes a very little tweak here and there, but that can make a huge difference. That's the same reason why we have like a lot of vaccines in different brands. I mean, they may all be particularly the same, just using different ways of like how to make it more or less response in your body to create a better immune response.
That's a lot right there. But it doesn't matter.
It can get so much more technical, and I don't want to throw all that. I mean, I can definitely provide more, but then I want to keep it like to the more realistic and make sure that everybody can do their own research again, and you don't have to go into
No, thank you for answering those questions and for joining us. You know, I know as you have one more thing.
One more thing, because the prior question, I didn't complete the prior question, which I think I missed something that's really good. Is that how we go from here isolation wise? Yes, we did. So quarantining, actually social distancing wise, yes, we need to continue doing that, because you get a vaccine, you're gonna hopefully not get sick. It's gonna help prevent as well. But we also want to make sure that if somebody if you're somebody that has not had and still got COVID, what is called cross-contamination, if you don't take care, you don't need to wash your hands, you don't need to protect your face. And if you touch something that's contaminated and then go and say, hi, how are you, and shake somebody's hand, you can still transmit by contact. So social distancing needs to be applied, and not just for COVID, right? For everything, technically speaking. I know, again, as a community, Latino community, we are huggers. We like our physical contact. I'm not saying we shouldn't doing that, but then definitely washing hands, keeping some distance.
You can never be too safe, right? And I know this has been a tough year for all of us, but especially for our yourself being on the front lines of this. I can't imagine, just hearing what perspectives have changed for you during this past year. What would you say you most look forward to or hopeful for in the coming year?
So, well, of course, number one, people accept the vaccine. And once we are hopefully in a better place to be able to go back to what, again, as they're going to go back to, as they were to go back to what defined as a community, to be able to be with our loved ones, to be able to gather, be able to give somebody safe a hug without knowing that you may actually hurt or even kill the person because of a simple hug. I know it sounds drastic, but that's what it is.
That's what's been happening, right?
I mean, I know I want to listen high note, but then I've seen patients that actually were sick, younger ones that they didn't know any better, and they went back to their parents, their grandparents, and sadly the grandparent ended up dying of COVID. And I've seen that story many times. And so I want to see that. I want to see people being able to happily and safely be with their family members and their loved ones without knowing that they may actually harm them.
Yeah, no, thank you for sharing that story, your personal experience. And I look forward to seeing us hug and kiss one another once again. Dr. Herrera, un abrazo virtual. Thank
Muchísimas gracias.
For joining us today. Thank you for everyone. A todos, gracias y hasta la próxima.
Muchas gracias por la oportunidad.